Good afternoon, everybody, and welcome. My name is Richard Fraser, and I have the honour of being chairman of this trust. And we'd like to welcome you to our annual general meeting for the trust, formerly known as St Helens and Knowsley Teaching Hospitals and NHS Trust, and Southport and Ormskirk Hospital NHS Trust. This meeting is being filmed and will be available online following the close of today's proceedings. I'm joined today by Anne Ma, OBE, and members of our Trust Board and Executive team, as well as figures from our local communities. And delighted to welcome the Mayor and Mayoress of Knowsley, the Mayor and Consort of West Lancashire, and the Mayor and Consort of Prescott. Thank you very much for giving up your time to come along and support us today. So, thank you all for being here today. And last year's St Helens and Knowsley Teaching Hospitals AGM was held via Teams on the 30th of September 2022. A recording of that is available on the Trust website, so there are no formal minutes that need to be approved. However, the Southport and Ormskirk Hospital NHS Trust AGM, which took place on the 22nd of September 2022, does have minutes to approve. So can I please ask for these to be approved and seconded now? Thank you, Anne-Marie, and thank you, Leslie. So the agenda for today's joint AGM meeting is as follows. In a moment, Anne Marr will review the performance at both trusts during the year of 22 and 23 and recognise the achievements over that previous 12 months and look ahead to our future as one single organisation. There will, of course, be an opportunity to ask questions, or if you prefer, we will also share an email address, and you could submit the questions in writing, and we will make sure an answer gets back to you. So that's all from me just now, the easy part. I will now hand over to Anne Ma, our Chief Executive. Thank you, Anne.
Thank you, Richard, and good afternoon, everyone, and thank you for joining us today. So, what was the story of 22-23? Were we back to normal? And the answer is sadly not. We weren't back to normal. And this next slide seeks to explain why that was. So just to orientate you to the colours on the slide. So the first block, which are kind of coloured in a blue outer line, are the 2021 figures for COVID. The orange are the 21-22 figures for COVID, and the sort of grey colour of 22-23. So what you see is obviously that period of very high activity for COVID in 2021. But it didn't stop there, and you can see as we went into the subsequent 2 years, we still had fairly significant numbers of COVID patients in both of our legacy hospital trusts. So what we can say is that those patients didn't tend to experience the same extreme symptoms and morbidity of the patients, or mortality of the patients that we'd had in the first year of the pandemic, largely due to the impact of the vaccine. But it did still mean that we had beds occupied, and probably as important to that, we had to take lots of infection control measures still. So what we couldn't do is just act like nothing was happening, because we still had to protect patients from contracting what might have been, for most patients, most vaccinated patients, a less severe form of COVID, but nevertheless, COVID was still very prevalent on our wards and within our patient population, and that did knock on to our ability to deal with our levels of activity. So the issues I'm going to deal with today are activity and quality and performance and those kind of things. So let's start with this. Because we've got two trusts we need to report on, we've got information for both Southport and Ormskirk and St Helens and Knowsley. So if we look at that table, we're comparing the The first year we're complaining with the year before the pandemic, because that was obviously a completely unusual year, 2021. And the second year, we just compared it with the year before. So those percentage changes for that. So starting with GP referrals, we'd seen a large fall in referrals at Southport and Ormskirk in 21-2 compared to pre-pandemic. And the reason for that was that the ophthalmology service closed to referrals, so we just eliminated all ophthalmology referrals. And because that is such a high volume specialty, it did have a really major impact on the referrals per se. So it wasn't that the Trust was losing referrals again, you know, and everything. It just lost all ophthalmology referrals. Moving on to the last year, the year in question that we're talking about, both trusts saw an increase in referral. At S&O, that was 5.1%, gynecology, orthopaedics, urology and respiratory, the main reasons for the increase in referrals. And at STHK, a 7% increase with gastro, gynae and orthopaedics as the major increased specialties. Next line's about first outpatient attendances, and as you'd expect, as we had more referrals, we needed to do more outpatients, so we did manage to achieve an increase in the number of outpatients we saw for the first time, in part and parcel of our attempts to recover our elective activity. Next line's about the cancer 2-week referral wait, and what's remarkable about those figures is, you know, if you take the cumulative effect from the year before the pandemic, we've got nearly a 30% increase in 2-week rural referrals, which is just an unprecedented increase. And both trusts and most trusts in the country seeing that same pattern of a massive increase in cancer referrals. So because we have to see all these patients in 2 weeks, it's a massive challenge to really accommodate a 30% increase in referral with the same number of staff at the same number of clinics and see everybody within the 2-week rule. So that's caused us quite a lot of logistical challenges to deal with. Next line's about elective episodes. Southport went down a little bit, not very much. STHK was up quite a lot. Again, these are the efforts to try and recover activity. But as I say, we were still affected by the impact of COVID, so it wasn't like we could necessarily use our capacity to the greatest extent. The next line is about ED attendances, and given what we experience here in the trust, and given what you'll read in the press, etc., you'll know that generally emergency departments are very, very much very busy, lots of high numbers of attendances. So you'd be surprised to see that the number of it's gone down, not up. But what has happened is that of the fewer patients who are attending, more of them require higher levels of acute care. So our number of admissions have gone up by, again, quite unprecedented levels. So for STHK, a 4% reduction in attendances has yielded a 10% increase in admissions. So that tells us that the patients who are presenting are more likely to be ill enough to be requiring admission than they were before. And so we've got the combination of a cohort of more acute patients, and we've also obviously got problems with discharge because of the capacity problems in social care particularly. And so therefore, this leads to a very congested bed base for our acute beds, and which backs into the ED and the ability to treat patients within our 4-hour standard. The last figure on there is on births, and both trusts have seen a reduction in the number of births, and we might speculate what the reasons for why there would be a reduction in the number of births after the pandemic years, and it could be, but it might not be, but it's a result of the lockdown ending, who knows. But we've certainly seen that pattern emerge, again, not just here, but across most maternity units. Okay, I'm now going to move on to quality. But before I do, I just need to mention that because I've now changed these metrics into some of them are just numbers, it's important to understand the difference in size between the two legacy trust. So just keep it simple. STHK is about twice as big as Southport and Ormskirk. So we'd expect all the figures to be half as many or twice as many to be consistent. However, the first statistic that's on the page is the HSMR, the Hospital Standardised Mortality Ratio. This is an indicator of quality based on whether or not trusts have the expected number of deaths compared to their presenting patient base, or whether they have more or less than you'd expect. So this is taking into account what's wrong with the patient, what comorbidities they've got, etc., etc. And that shows that, so 100, it means you're on a level, and anything less than 100 is good, and anything more than 100 is bad. So Southport way below 100, STHK just below 100, but both on the right side of the line in terms of safety. Never events is the next line, and these are things, as it implies in the title, that should never happen. But sadly, occasionally they do, and we are required to report them, and we are keen to learn from when we have a never event. So we had 3 in Southport and Ormskirk and 2 in St Helens and Knowsley. And the kind of incidents I'm referring to is the 3 in Southport were a retained guide wire. Another one was that 2 patients were mixed up with the same name who ended up having, one of them had an unnecessary diagnostic test, and third was a patient was connected to air instead of oxygen. 2 at STHK were a wrong skin lesion was removed. There was a number of skin lesions this patient had, and we removed the wrong one, but quickly recognised it and then removed the right one, and also a guide wire being retained. So what we do in these cases is we do a really full investigation, and we make sure that any corrective actions are implemented, lessons are learned, and we may provide additional training. So we do take them very seriously and make sure we take appropriate action if they do unfortunately occur. Next line's about MRSA. The ambition here is to have 0, and Southport and Ormskirk achieved that, and St Helens and Knowsley had 1, which was investigated and deemed to have been avoidable. So again, that was the lessons were learned from that case, and changes were implemented. C. diff, although those figures look wildly different, we're given targets to achieve, and both trusts achieved the targets for C. difficile infections. Pressure ulcers and falls, these are the things we try to have, again, 0 figures for, but sadly, given the patient population we serve, that's not really possible to achieve. So we try to get these numbers just as low as they can possibly be. And we've managed to reduce the number of pressure ulcers, which has been the result of a lot of concerted efforts. And Southport did well equally on the falls, but STHK had a slight increase in the number of falls. But when compared to the size of the patient population, probably about the same rate of falls, in perhaps even a bit less in terms of the falls per 1,000 patient days. And finally, the number of complaints has reduced at both trusts, and again, using other trusts as a comparator, that they are very low numbers. Moving on to performance. So on this slide, I've tried to give you what the target is, but given not many places actually achieved the targets in the aftermath of the pandemic, given what the national performance is so that we can see where we are relative to where everybody else is, and given the figures for both trusts again. So the 4-hour ED targets, as I've just said, really having a difficult time with this one, given the sheer number of patients presenting to the trust and the fact that the bed occupancy is well higher than it would need to be to enable us to manage efficient flow through the hospital. Having said that, the national score is 70.7%, which is equal by STHK and bettered by Southport and Ormskirk. 18 weeks RTT, having moved from a position before the pandemic where neither trust would have any 52-week waiters. They didn't exist. It's not something we're used to having to report. We've now got small numbers of patients waiting that amount of time, and the performance against the 18-week target obviously compromised by the fact that we've got this enormous selective backlog. But again, both trusts doing better than the national average. Counter 2 weeks I mentioned before, with the increase we've had in activity, been very, very hard to accommodate seeing the patients in the requisite amount of time. The target's 93, the national figure's 78.9, and again, STHK equally, Southport and Ormskirk are better than the national average. The other important cancer target is the 62-day target, so this is the point at which patients actually receive their treatment. So important that, you know, whatever happens earlier on in the journey, that we make sure we get the patients treated. The target's 85% of patients should be treated within 62 days. Nationally, the figure's only 60.7. SNO just below that, but STHK way above. So obviously, as we've come together as two trusts, we know there's things one trust does really well and things the other trust does really well at, and we're just making sure we learn from each other and adopt best practice in both places and share resources where that's appropriate, so that we can get that to be, from an overall trust point of view, as high as those figures can possibly be, given the challenges that we've got. As I mentioned, the 52-week figures, again, you know, relatively small numbers, but big issues for the patients who are part of those numbers. We recognise that's not where we need to be at all. The diagnostic figures are based on how long it takes to get to a diagnosis, and it shows that, you know, we should be at 99% within the time span we're given. That's 99% of patients receiving the diagnosis within 6 weeks for the test. Sorry, having the test within 6 weeks. And the national average, 74.9. SNO, again, a bit higher, and STHK a bit lower. So, again, another example of where we can potentially, you know, share what we do to ensure that we get the best outcome across all of the new trust. So finance, we have plans we have to deliver, and sometimes they can be deficit plans. So just because there's a deficit doesn't necessarily mean the trust didn't achieve its plan, and the case was for 22-23 that both trusts did actually achieve the plan that they'd agreed with NHS England. So Southport finished the year with a 14.7 million deficit, which was planned, and STHK with a 7.1 million surplus. So the surplus enabled STHK to generate capital into the current year, and that's largely being used to invest in and scheme to create additional theatres. Southport weren't disadvantaged by not being able to generate a surplus to fund its capital, because we were able to access separate and substantial capital funding to address particularly the backlog maintenance issues at Southport and Ormskirk. So, another challenging year. So, very difficult winter, compounded by major barriers to discharging patients due to lack of capacity in social care, resulting in record levels of bed occupancy, which were over 100%. So, in other words, there were more patients who had been admitted to a bed than we had beds to give them. And that means we end up with patients queuing back into the emergency department because we've got nowhere else for them to be. So that's not where we want to be, and that's what's causing the overcrowding. What we would like to say, though, is the way our staff respond to that incredibly difficult situation is, you know, just absolutely inspiring, and their resilience never fails to impress us, because they're responsible for maintaining high standards of care and keeping the patient safe in terribly, terribly difficult situations, and they do it, with a great attitude and great kindness and great care, and we are very, very grateful to them for that. We also last year had our first of several periods of industrial action. And whilst we recognise that pay for NHS staff is a matter for negotiation between the trade unions and the government, it's important to reiterate that as a trust we fully respect everyone's choice to strike or work as normal, and I'm really grateful for the way our staff, whatever the circumstances have been, have responded and cared for our patients and made sure they continue to receive the care they need during whatever difficulties we encounter along the way. So, highlights of the year. So, despite the fact that there was, I'm to paint the picture of, how difficult it's been, there were some great highlights as well, and I'd like to share them with you now. So, in September 2022, following a year of collaboration, we began a formal process of our two trusts becoming one team, one trust. We are incredibly grateful for the work of so many colleagues and extremely proud of how people worked together over many months to bring this collaboration to fruition. So already we had been successfully bringing our departments together to combine their expertise and to start improving the delivery of care to patients across all of our populations. So just two examples here. We've got a new rheumatology clinic at Ormskirk Hospital, which has produced excellent results to benefit local patients, with additional local clinical sessions enabling us to significantly reduce waiting times for rheumatology patients. And the photo on the left there shows Dr. Julie Dawson, consultant rheumatologist at STHK, and Rachel Finch, physician associate at SNO. And here they are, jointly putting this service in place to really help patients out and make that service much more local to them. The second photograph is from staff from both trusts who worked together to temporarily relocate some joint replacement surgery whilst equipment was being upgraded at Wiston Hospital, again thereby exploiting the benefits to patients of being able to maintain that activity while some changes were made to the premises here. So at first the team fed back that it was a bit cautious at first, understandable, but that the sharing of ideas and the sharing of practices was led to a really successful working partnership, and they're very keen to develop further. So on to the year ahead. That was when we became. 1st of July 2023, we became Mersey and West Lancashire Teaching Hospitals NHS Trust. And whilst our name is meant to give the best indication we could come up with of the wider area that we now serve, it's really important to note that all of our 5 premises will all retain their original names. So we will maintain the names of Ormskirk and Southport Hospitals and St Helens and Wiston, and also Newton Hospitals, which is part of the former STHK. So the names remain the same, the trust name has changed. Okay, so just something about the new trust. We serve a population now of over 600,000 people, and that scale gives us the opportunity to deliver a broader range of services. So our population that we serve now covers Halton, Knowsley, Liverpool, Sefton, St Helens and West Lancashire. They're our main customers, if you like, for our services. We also provide regional services for burns, plastic surgery and spinal injuries across all of Merseyside and West Lancashire, Cheshire, the Isle of Man and North Wales. We have a combined workforce of around 9,000 staff. We've got 21 different locations because we have community premises, a GP practice, etc. And our 5 hospital sites that I mentioned before. And our annual revenue turnover now is £850 million a year. Our vision as an organisation, as Mersey and West Lancashire Teaching Hospitals, is to deliver 5-star patient care. And the point of delivering 5-star patient care is to ensure that we deliver the highest standards of safety, that we give care that is evidence-based, high quality and compassionate, that we have communication that is open, inclusive and respectful, that we have systems that are efficient, patient-centred and reliable, and that we have pathways that are best practice and embedded, but that also respect the individual needs of patients. And we intend to deliver that vision to all of the people within our population and our catchment, and for that to be as close to their homes as we can possibly make it. So we intend to do as much as we can in all parts of our catchment, but there will be some things that need to be centralised one way or another. But largely our approach to this is, if it can be local, then that's where it will be. So the next slide shows the trust objectives, which we held back until July when the coming together of the 2 trusts was finally agreed, and so these were launched in July. So what we do with the objectives is we don't have our vision statement as something that just sits there and is said. We make sure it's translated into a set of actions and a set of objectives, and each objective is allocated to an individual executive director. Everyone in the organisation at the end of the day answers to an exec director, so it's cascaded down through the organisation, and in that way we progress towards achieving the vision that we've set for ourselves. It's not just a thing we say, it's a thing that we do. And I don't expect you to be able to read any of that, so just to summarise what it basically says and all of that, the main priorities for the Trust are to continue to support and promote the health and well-being of our staff, to improve safety and reduce avoidable harm, especially across pressure ulcers, falls, as mentioned earlier. Focus will remain on restoring elective activity and reducing waiting times. And in line with the Ockenden recommendations, we will further improve the experience for women and their families using our maternity services. We are going to progress the agreed capital schemes to improve and expand our clinical facilities, and that's across most of our sites, get some share of that. And we'll also deliver on the financial targets that we've agreed with the regulators. So, it would be nice to be able to say that one day we'll make Mersey and West Lancashire Teaching Hospitals one of the best trusts in the NHS, and to which the exec directors raised the eyebrow, because they don't usually do one of the best in the NHS, it has to be the best in the NHS. So that's always my ambition, is for us to be the best. So that's what I want Mersey and West Lancashire to be, at the top of that league table of which is the best trust in the country. Now, all of this is only delivered by our amazing staff. So we can say all of this, but at the end of the day, whether we deliver this is down to the activities and actions of our staff. But we've got a great team, and we've already seen just how many obstacles they can overcome and how much can be achieved when everyone works together, when everyone really cares about the patients. So I've got every confidence that we will deliver our plans for this year. Thank you, and I'm going to hand back to Richard.
Thank you very much, Anne. Now, we've received 3 written questions from Mr. Barry French, who's here today. Thank you for your questions, Barry, and we'll now run through those. If we can have the next slide, please. So you can see the first question was to do with shaping care together. That's been going for some time in Southport and Ormskirk. And following the formal creation of Mersey and West Lancashire Teaching Hospitals NHS Trust from the 1st of July, with that change, the Shaping Care Together Programme Board has met to further review the programme. As a result of this, with a renewed focus on these changes and opportunities that provides, the communications and engagement with the local population will recommence. And that will happen in the very near future. This will provide an opportunity for all stakeholders, including local residents, to be involved in the development of services in the Sefton and West Lancashire area. And I'm confident there'll be improved services because of the added strength we get as 2 trusts now acting as one single entity. Thank you. Next slide, please. The next question was to give an update in the ophthalmology department and macular degeneration. Well, we have provided an age-related macular degeneration service at St Helens Hospital for many years. Now we are this one trust. The various specialities are working together to ensure that we level up the provision of this treatment across all of our sites for all of our patients. So wherever possible, and we will therefore, whilst I'm unable to give exact timescales, I can confirm that it is our intention to provide this service at Ormskirk Hospital. Next slide, please. And Barry's final question was, have the Trust got any plans to start running walk-in centres instead of the existing private provider? Well, obviously we're unable to comment on the contractual agreements of other organisations because it wasn't organised by us. However, our Trust already has experience of running urgent treatment centres, and that service in the borough of St Helens particularly. So this would be an area of service provision that the new Trust of Mersey and West Lanc would be comfortable in exploring if that opportunity should arise. So fingers crossed it will. So does anyone have any other questions for today? Please. We'll just get a microphone for you. Thank you.
Yeah, what's been in the news in the last couple of days is ambulances. The ambulance service saying that they're waiting 40 minutes for Cat 2. Ambulances are blaming it on trusts. But ambulances being tied up at A&E departments. I mean, and also patients, only 70% hitting the 70.7% hitting the 4-hour waiting target. I mean, I know the hospitals got less beds now than they did 20 years ago. They've got something like 2/3 the beds in England. I think in 2000 we had 240,000 beds. and in 2021 it was less than 160,000. So it's not rocket science. You're an ageing population, and you've got 2/3 of the hospital beds nationally than what you did have. So any plans how to impact that? I mean, only today they had a phone in radio about the ambulance on the Cat 2 taking 40 minutes because blaming basically they're tied up at A&E departments.
Yeah, this is what I was saying before about the problems we've got with the bed base, yeah, so I'm kind of agreeing with you because when you do a simple calculation of multiplying the number of patients we get that need to be admitted with the length of stay, which is not remarkable by comparison with other trusts, it's more beds than we've got, so you're absolutely right to say that the bed base really that's available to us doesn't really match the demand that we're being subjected to. And of course, we can't nip beds because we've got nowhere else to put them. And even if we could, when we can't get staff, so the problem we have is we're trying to deal with a problem by making incremental changes. So there's lots of things we're doing to make incremental changes that, so flipping wards from elective to non-elective, but then we don't really want to do that because we need to get rid of the elective backlog. But the emergency patients do come first when all's said and done, and we always maintain the urgent elective workload, but your waiting list then just gets longer. So everything we can do, and there's lots of things we've done that sort of, I won't say tinkers at the edges, that's not fair, that makes some impact, but it doesn't solve the whole problem. So the reason why we have it is, as I said before, we haven't got enough beds, patients back into A&E, can't get the patients out the ambulances because there's no way to put them in A&E. We get corridor care going on, and it isn't what we want. And I'd give you right on. If there was some magic wand you could wave and fix this, we'd be fixing it. We really would. We've also got all kinds of problems with accessing social care for patients who are in the hospital that could be somewhere else. If only they could get that care that they need elsewhere, which doesn't do the patients any good, but also keeps patients waiting in A&E. And therefore delays the handover ambulance patients. So unlike some areas, we do work very closely and collaboratively with the ambulance service. We don't have a standoff thing going on, which you get in some places. We don't. Nowhere in Cheshire and Merseyside, we have positive, supportive, sympathetic relationships with the ambulances. They get what our problem is. We definitely get that. We don't want category 2 patients waiting for 40 minutes. We absolutely, honestly get it completely. So it's like always a question of just doing as much as we can to keep the waiting and handover times as low as they can. But we're far from being able to get into a position where we'd really like to be, where we don't have patients waiting around in ED, and we certainly don't hold ambulances up. So anything we can do to make it better, we're doing it. But there's lots of things we're not in control of.
Thank you very much for your question. And as Anne says, we do have an ongoing and very close relationship with the ambulance service to try and make sure we make the best of what is a very difficult situation in what is one of the busiest trusts in the whole of the North West for ambulance arrivals. Does anyone else have a question? 1 minute, we'll get the mic to you. Thank you.
Yeah, my name's Barry French. I asked a question on shaping care together, but in your reply there was no definite date. And this has been going on since 2019, when I first started having meetings with Homescare Trust. Is it going to be started this year or 2024?
Yeah. Barry, there is a formal process to go through. Now that we are a single trust, there's a formal process to go through which will include public consultation in the shape of the care that we give going forward. That's subject to a number of constraints out with our control timescale wise, but I can tell you it's already started as far as we're concerned. Do you have another point to make, sorry?
It's just all hearsay, there's no debt. You should be able to say it's going to be, we're going to be meeting this year.
It's not on, the mic's not on.
It's just that it's gone on, and I know it's only just started in July, but we should have a definite date. I've been to many meetings and meetings online, and then it just stops. And then I get an email now and again saying it's still going on. But it is just going on, and we're getting nowhere further. It's just a definite date, either this year or next year. You can't just be waffling. It's just not acceptable to me anyway.
Well, I understand your frustration, but can I say that the Shaping Care Together team, which included other agencies, our local authorities, input, etc., our care commissioners, they were looking at it as purely Southport and Ormskirk. It's now not just Southport and Ormskirk. We are this larger, more powerful trust. So that's why we're reviewing it again, and that's already started. So I can assure you, from our point of view, we'll be pushing this forward as quickly as we possibly can. But there are timescales out with our control, legal and governance from the Secretary of State, that we cannot control. So all I can assure you, Barry, and I know it's difficult for you to hear, we will be pushing that as hard as we possibly can. And if you want to give me your details, I'll keep you informed personally. We okay?
Yeah, if I can just speak on your behalf, Mr. French. What we're going to do, Richard, is I'm going to do a transcript of your response, email that to Mr. French, and then he'll pick that up directly with you. Okay. Is that...
If he can include his contact details, I'll contact him directly and give him an update.
Richard will contact you directly. Is that okay? Thank you. Thank you, Richard.
Okay, thank you. Any other questions? If anyone has a question afterwards, please feel free to contact me at chairman@sthk.nhs.uk or coming through the switchboard, and we'll get back to you with an answer if you indeed think of a question. Don't make them a difficult one. So can we have the final slide, please? So finally, all of our statutory documents, the annual reports, annual accounts, the quality account for both trusts, will all be uploaded onto the Trust website. The statutory deadline for that is the 30th of September, and they will be on before then. If anyone requires a hard copy or would like to request those documents in a different language or easy to read version, please let us know and we will get that to you. And as I mentioned earlier, the meeting has been filmed and will be available on the Trust website very shortly. And that concludes the formalities of the annual general meeting. I'd like to finish by adding my own heartfelt thanks to all of our staff and our partner organisations, because we don't work in isolation, for everything they have done this year. A very, very difficult year for our NHS, and that's what it is, ours. Let's never forget that. I'd also like to thank everyone across our local communities and thank our leaders for coming along again today for their incredible support. Thank you all. The meeting is now formally closed. Thank you.